So when you've got a sore back, it often feels very tight and knotted and it's very difficult to move around. But if you suddenly stretch too quickly and too much, you can do more harm than good. So this video is designed to get your spine moving very gently so that you can gradually unlock that knot, untie those knots in your spine and feel much better. And then you can stretch towards the end of the video. So let's get started. So you'll need a wall and position your feet about hip width apart, just slightly away from the wall. Keep a little bit of give in your knees, and we're just going to settle the shoulders back against the wall and pull the tummy muscles in and just look straight ahead. So shoulders back and down. And we're just going to tilt the upper body. You can see I've got my palms on the wall, just side to side. Try to keep your bottom still, your legs still, and your tummy muscles pulled in very gently. Now, if I'm going too far, you don't have to go as far, just a tiny little bit. Just feel your upper back sliding along the wall. Relax your hands. That's it. So you're kind of making a semicircle, a rainbow shape. Good. You can go further if it feels okay. Of course you can. And don't forget, don't hold your breath. Now we're going to bring it back to centre and turn the palms to face forward. I'm just going to bring one hand around, lifting that shoulder off the wall and then coming back and then going the other way. And what I'm trying to do again is just to keep my bottom on the wall, my lower body, my legs still. Remember, you keep a little bit of softness in your knees and you move very, very gently, not forcing it at all. So if you can't go as far as that, that's fine. So what's happening here is we're getting upper body rotation. We're trying to move the upper body around in a kind of circle shape, I suppose, just coming around to the other side, turning the chest. The head moves with the chest at the same time. And just keep breathing, but try and keep your bottom flat on the wall and your legs still. Lovely. Let's just do one more to the other side. And again, if that was too much, don't do it as much. You can make it a really little move. Okay, just let your arms rest by your side, shoulders back and down, but then round your shoulders away from the wall and then gently retract them back towards the wall. And just see how that feels, keeping your knees soft and your tummy in and your breath flowing. So again, you can make it a lot smaller, but we're just moving the shoulder girdle and the upper back here. So just a couple more here. Again, if it feels uncomfortable or unpleasant, or if there's any pain, either stop or make it a lot smaller. Now just take your head back so it very lightly touches the wall and bring your chin towards your chest. Keep your shoulders still now, back and down against the wall if they will. Don't worry if they won't, but just try and keep them still. So the cervical spine, the back of your neck, just moving here, up and down gently. Keep breathing. Bring your chin back up so you're looking straight ahead and just do the head now, side to side. Don't force it, keep your shoulders still, keep them relaxed. So you can do more or less of these depending on which part of your spine is feeling tense and sore. Keep breathing. Just one more to the other side. Lovely. Okay, so if you put your hands flat on the wall again, tummy muscles in, knees are soft, and we're just going to lift the bottom away from the wall and start lifting the lower back off as well. Keep your tummy in and try not to squeeze your bottom. And then replace the lower back vertebra by vertebra until your bottom is slightly sticking out and pressing gently against the wall. You should feel a little gap where the lower back, the lumbar spine curves like that away from the wall. Don't worry if you can't get your hand behind. It might just be that you can't feel pressure into that area because of the natural curve of your spine, the concave curve. So we're going to again lift the bottom off by just sort of scooping the pelvis, coming up the spine. If that's too far, just take it a lot less. And then vertebra by vertebra, so each vertebra, if you can, gets its turn at touching the wall. Relax your shoulders and arms, and again scoop the pelvis, pull the tummy in, try not to squeeze the bottom. Keep your shoulders against the wall and your knees soft and keep breathing. Just go with how you feel. You're moving your pelvis as you come up and then as you go back down so that every vertebra in the lumbar spine gets its turn. So this is really one to enjoy. Don't let your shoulders tense. Keep your head still, keep your tummy in, keep your knees soft, and don't forget to breathe. Make it a lot smaller if you want to, if you need to. Let's come back to the normal position that we had at the beginning. Just relax your arms and let them dangle by your side. And we're just going to lift one heel, keeping the leg more or less straight, but keeping the knee soft, and allow that hip to go up. Just feel your shoulders in the same place on the wall, and then lower that heel and change sides. And again, the other side. So just lifting the hip bone and letting the pelvis rock to and fro. But the upper body stays still. Now again, you can make this so tiny so that somebody watching you would barely see it. Keep your head still, keep your shoulders still. Just see how it feels. Play around with it very gently and breathe. Remember, don't lean the upper body. We're keeping that still right now. Let's just do one more on the other side. And replace, keeping the knees soft. We're just going to place the hands at the top of the thighs and bring the chin towards the chest and curl down, peeling your upper spine off the wall a little bit and then rolling back up again. Keep your tummy in, keep your breath flowing. Maybe lift the chin a little so that the back of your head touches the wall, and down we go again. Try and keep your shoulders back towards the wall. They may roll forwards a little bit. Soft knees and roll back up. Vertebra by vertebra. This time you can maybe go a little further. So starting behind your head, sort of your neck area, and then coming between your shoulder blades and lower down your spine, tummy in, and then roll back up. If that was too far, don't go that far. Just listen to your body. Let's go one last time, and you can start to slide your hands down your thighs, keeping your bottom on the wall, tummy in and breathe. Try to keep your shoulders back, but if you need to let them hang forward, that's fine, as long as you roll them back as you're coming back up. Breathe, use your tummy muscles. Lovely. Okay, so we're now going to come away from the wall and sit down on a chair or on your bed. Place your heels under your knees, so you've got a right angle behind your knee joints and your knees and feet about hip width apart, and sit tall if you can. If you want to use the back of the chair to support you, that's fine. You can sit further back, but pull your tummy in a little bit. Now the good thing about a chair is it fixes your hips, so we won't be moving our hips, so we can get some upper body rotation, a little bit more than we did when we were against the wall. So I'm just going to hold the chair with one hand and bring the other arm across, turning my chest towards it, and then come back to centre, and the same the other way. So moving from the waist area, but you're moving your thoracic spine, your mid-spine. Make it fluid, make it flow, don't force it, and don't go this far if it feels that your back is too tense. Try and breathe through it, keep your shoulders in place, back and down, and just enjoy this little bit of movement. Now you can do more of those if you're enjoying them, or you can try some tilts. So again, you can hold the chair, and the side that you're tilting to, you can reach your arm down. Again, not forcing it, not shrugging your shoulders. The chair gives you support. You use your tummy muscles to bring you back up, so always keep your tummy muscles in. Try and relax your legs. Keep your feet on the floor and your bottom firmly on the chair. Breathe through it. I'm just going to do one last one here. Bring it back to centre, hands on thighs, and then we're just going to curl down as we did from the wall through the vertebra, bringing your chest towards your thighs. You can let your arms dangle towards the floor if that feels okay, or keep your hands on your thighs, and then roll back up through the vertebra, rolling your shoulders back and down. We do one more of those. So chin towards your chest, and then we curl down from the spine at the top towards the base of the spine. Let your arms dangle if you want to. And then hands on thighs to help you come back up, but use your tummy muscles as well. Chin comes last. Finally, we're going to go to the floor. So I've got a mat ready. So make sure you move carefully off your chair. Use your tummy muscles. So I'm going to lie myself down carefully. Take your time. Remember, you can be on your bed. Bend your knees, bring your feet and knees together, and take your arms out wide. So I'm just going to let my knees and my hips roll to one side. and keeping my shoulders on the floor and my arms out wide to give me some support. Back to centre and across the other way. So this can be even smaller than that. Just make it within your comfort range. Just getting some movement through the vertebra. You don't have to feel that you're stretching. We're just getting the movement. And gradually, if it feels okay, go a little further. Okay, so remember, keep your shoulders relaxed and on the mat as best you can, because this is just lower body rotation. Again, we're moving the spine, the middle area of the spine. Now let's bring our legs all the way to the floor if possible. If that means you have to let your arm follow, that's fine. But once you're lying on your side, maybe you can take that arm back again so that your chest is more towards the ceiling and your lower body is to one side, and you can even cross your top leg over. Relax your shoulders, see how that feels. Maybe turn your head away from your legs. Now you can hold this position for as long as you like. But of course we have to do the other side, so we're going to carefully move to the other side now, or you can pause the video. You know that you're going to be eventually doing the other side. Take your time, enjoy it, don't force it. If it needs to be your upper body half coming to the same side as the legs and hips, that's fine. But if you can, and if it feels okay, just let your chest face the ceiling more, and you can cross your top leg over your bottom leg, and you can turn your head away from your legs if you want to. Just relax here. Focus on your breath. If the stretch feels too intense, don't do it. Bring it back. Bring your upper body more to the same side as the legs, and just enjoy this sort of side-on lying position. So go with how your body feels. The more your legs are one way and your upper body the opposite way, the more of a stretch you'll feel. I'm going to bring it carefully back to centre now. Just hug the knees in towards the chest. I'm moving very slowly. So don't force it, just hold your legs as far in as you feel comfortable, and maybe rock side to side. Maybe take your knees round in a circle and the hips will follow, and maybe go the other way. Just massaging into your spine here. Keep your feet relaxed, shoulders relaxed. So I'm going to roll onto one side and use my hands to help me. I'm then going to come onto all fours. And we're going to do the tail wag. So on all fours, try and keep your tummy in. Your hands are underneath your shoulders and your knees are under your hips. And you just wag your tail side to side, look over your shoulder at your tail, and then change sides. Very slowly, very gently. Try and keep your chest still and your shoulders still. You always have to have a point of stillness. So we're moving the pelvis side to side, looking at your tail as you wag it, moving the head. And we're doing it very gently and slowly, remember. Bring it back to centre, scoop the pelvis, chin towards your chest, pull in your tummy a little, round your shoulders. And then roll your shoulders back, stick out your bottom, look straight ahead. And then scoop and round. So the cat stretch, rolling the shoulders back, sticking out your bottom, looking straight ahead. So we're getting the spine moving here too. And now we're just going to bring ourselves back, slide the arms out, and just enjoy this little stretch here. Hopefully you've enjoyed the session, you're feeling better, and you're ready to get on with your day. If you enjoyed this video, please subscribe and share it with your friends, and I hope to see you next time.